So this is a 53-year-old lady. This was a case done in 2014 with a history of acute coronary syndrome. She was presented with severe left ventricular dysfunction with pulmonary edema. So angiogram showed triple vessel disease, and if you look at all discrete lesions in the LAD, in the circumflex and the right coronary. So we offered her multi-vessel PCI, and it was done in a staged way to the Zion's expedition stents to LAD and circumflex, and also to RCA with the Zion's prime stent. So all these were done with angiographic guidance alone. Imaging was not done at the time, and it was a very good result angiographically, and she did very well clinically. And she was on regular follow-up. At 1 year, she was asymptomatic and had a normal LV function and a negative stress test. And however, because of she was continued on DAPT, and but ticagrelor was changed to clopidogrel and aspirin in view of multiple stents, and she was continued on DAPT even after 1 year at that time. And following that, after a few days, she just came up with the chest pain. About 10 days later, she came after the follow-up. Just after 10 days, she came up with the chest pain, which is typical like angina, an exertional angina. But since she had a negative stress test about 10 days ago, and she's coming back again with the angina on exertion, very suspicious of an acute coronary syndrome, she was taken up for a coronary angiogram. And this was the angiogram done 10 days after the follow-up. That is 1 year after the PCI, which showed, you can see that angiogram, and the LAD shows a discrete tight lesion just above the stent, just at the proximal end of the stent. And you can look at the right coronary artery, it looks normal, and you can look at the circumflex stent, which is looking a bit over dilated. So this was the angiogram at that time. So how do we treat this, and what is the possible cause for this? She's been asymptomatic for 1 year, sudden onset of exertional angina over 10 days. And what is this? Is this edge restenosis? Or is it a kind of neoatherosclerosis, a stent thrombosis? Or is it a ruptured plaque? What is this? And what are the next steps? Should we treat it or image it? And how do we treat it? So I think I will now request, and this is the angiogram again in the IVS. Now let's, and you could see in the IVS, I would show you again a still picture. If you look at the IVS, you can see that there is a gross malapposition on the stent, and you could also see what we saw that at the discrete lesion is actually what we saw is a thrombus, possibly a thrombus, and this is the situation.